Oh, it's not that bad, is it? Anyway, I figured this is the 39th year since the PASS program has started, but you're actually the 40th class, so congratulations, milestone. So welcome everyone, students, families, and invited guests. Welcome to Penn Dental Medicine, and welcome to the University of Pennsylvania. You have chosen to come to a school which is rich in tradition, spanning 3 centuries, and yet one which is always in front of innovation. Our vision and philosophy, among others, include fostering humanistic environment, delivery of high-quality evidence-based patient care, shaping the global dental profession, promotion of interdisciplinary collaboration, which accelerate innovation, scientific discovery, and mentoring exceptional leaders. One of Penn Dental Medicine's strengths is its good fortune to be located within walking distance of Penn's other 11 graduate and professional schools. Our unique, vibrant campus enables us closely to collaborate and in ways which are unimaginable in other schools. Indeed, our students and faculty work together with the schools of medicine, law, engineering, and applied science, Wharton School of Business, veterinary medicine, nursing, as well as School of Social Policy and Practice. In addition to obtaining superb education, the opportunities to enrich your education via selective courses, enrolling in senior honors program, obtaining dual degrees with our sister schools, attending hospital-based externships, engaging in research activities, and community-based programs are really second to none. We all realize that you past students had to overcome incredible challenges and obstacles by immigrating to a new country, adapting to a new culture, and above all, having to return to dental school once again, which is not easy. We therefore admire your determination, discipline, and personal and financial sacrifices you had to make to get to this point. I speak on behalf of the entire Penn Dental School family, assuring you of our dedication and commitment to make you proud of your decision to attend Penn Dental. We wish you all the best. And now it is my pleasure and honor to invite our Dean, Dr. Mark Wolf.
Hangorski. Welcome, everybody. It's really wonderful to be doing this. Just this opportunity to see everyone together, to join us in this tremendous effort of creating an environment that you will have a whole new education and an additional handful of things going on is just an exciting moment as you really get started. So it's really wonderful to see you here. We don't have any more snow. We do have lots of cold. We'll have more snow. We'll have more cold. You have 2.5 years. We'll get you to May of 27. And it'll all be over, and you'll probably go somewhere colder and snowier, but you never know. Dr. Hangorski said something interesting. Every one of you come here as a trained dentist already, and that puts a tremendous commitment on Penn Dental Medicine to do something that's special, that's more than that represents a greater education, make more of you today than you came here with. Because if you go out with less or the same, this was not a great 2.5 years. But I can promise you that Penn Dental Medicine is committed to doing the next 2.5 years with you and transforming you into somebody you yet have to imagine. It's a wonderful opportunity. I welcome the family, your friends, the people who have joined you, and I look forward actually to the grand celebration in a very quick 2.5 years where we watch you graduate from Penn Dental Medicine. You come here during interesting times in America. No matter what our political thoughts are, we're about to see change. Don't ask me what, but we're about, any of you Canadians? 51st state, I mean, welcome. I'm not sure, does that mean we're invading? Never mind, we're not going into that. You'll know shortly what my real political bend is, but that's not for a white coat ceremony. It's a great honor to be dean of a dental school that was created in 1878, one of the very first university-based dental schools in the United States, one of the world's leading schools. You know all of these statistics because you chose to come to Penn Dental Medicine as your choice of education. I know everything about you as far as you're really smart, really capable, had many, many experiences as a student. You're going to be incredibly good practitioners. But the things that you don't realize is you joined a family, you joined a neighborhood. Penn Dental and Penn Dental alumni are a very unique group in our nation. This will be an alumni that lasts with you literally for the rest of your career. It's an incredible opportunity for you to get out of our university absolutely everything that it offers you in every different way, whether we're speaking about supplemental graduate programs, research programs, education programs, nighttime lectures and presentations, clubs, community dentistry. We have an incredible environment. We're here for you, by the way. Your faculty, your staff, we care that you will be the very best graduates possible coming through Penn Dental Medicine. And that's such an important item to hear, especially in these very odd times. So what is one of the very top things that I look forward to seeing you learn and be able to communicate and speak about? You know, in a world of AI, that we can make images and have conversations that actually never occur between the two of us. I just need a couple of moments of you speaking. I need your image. If I can get a good 3D image of you, you know, I can sit and have conversation with any of you for days and hours about things that never actually occurred. Well, so let's pretend we're a patient. Penn Dental Medicine has seen 2 giant pandemics that have killed hundreds of thousands. One that took place in 2020, COVID-19, and then we're talking about the 1918 flu, which once again, we just totally mismanaged how we're going to go out and do that. There's been a change. You know, when we talked about people needing to be vaccinated, we never imagined that a patient's going to come to us and say, well, I heard there were little trackers in that vaccine and you're going to be able to track me with this. I don't want to take that vaccine. Or that I heard somebody becomes magnetic and a spoon will stick to their head. And they're showing pictures of this stuff. I had staff members, when we were mandating that all staff had to be vaccinated, I had staff members that said, well, I'd like to do my own research. I don't really want to be told that I have to be vaccinated. And I said, oh, that's wonderful. So you're going to get 400 people that haven't been vaccinated. You're going to give 200 of them the vaccine, and 200 of them you're going to give a placebo, and you're going to see how many of them get sick. No, I can't do that. I'm going to look on the internet. That's the research they wanted to do. Now, I have to tell you, back in the old days, 2020, when the internet was like the nth thing for us to go look at, that almost made sense. And you might be able to figure out the real from the fake, the the misinformation from the real information. Our key to our educating you is going to actually be very different. So today we're not talking about vaccine. We are talking about vaccines. I'm not going to talk about them anymore. We're talking about fluoride. Does growing up in an area that has fluoride in the water lower your IQ? How are you going to have that conversation with that patient about the fluoride in the water when that patient knows the correct answer? They've AI'd it and gotten an answer. Worse than that, they've listened to a feed on a podcast that comes from somebody that is an anti, and they get all the facts. They've gotten them all. Never read a scientific paper. Do you know that they're talking about 2.75 points of IQ difference in the papers that were actually published? Do you know that the accuracy of an IQ test is not 2.75 points? The younger you get, the larger the error. The error can be as large as 20 points in 3 to 5-year-olds. But they're talking and quoting studies that decreases, particularly in males, it decreases the IQ. And they're positive. And you're looking at this poor child sitting in your chair, either with tremendous potential to get tooth decay or with a mouthful of tooth decay, and you're going to have a cogent discussion on why this parent needs to think differently if this child is going to have front teeth when they turn 8 years old. That's a unique education. It's an education that's actually not all about dentistry. It's all about how we speak to each other. It's understanding the social networks that people are in and what they learn and how they understand that going forward. This is an incredible challenge because it's not going to be as simple, as I say, as just handing somebody the facts. You want to have a discussion with me about fluoride, I'm game to do that. I've got a computer that's got 70 articles that have been critical of fluoride and hundreds that have been laudatory of how it is effective. I dump them on both of us. We sit down, we read them as critical readers of the literature, and we come out with an answer. By the way, I'll give you the short notes on it. The answer is fluoride doesn't lower IQ, it doesn't cause bone cancer, it doesn't do, there's never been any proof that that's actually true. But can I actually have that same conversation with a patient? Can I actually, and it's not the patient, it's not the, I'm dealing with the parent, I'm dealing with the caregiver, and I'm trying to save the smile of somebody who yet is not able to make that decision for themselves. Now, I wish I told you that this never has occurred to me. In my 35 years of practice, I was rolled out by the American Dental Association, by companies, by other people to be an advocate for fluoridation, fluoride water, fluoride toothpaste, fluoride vitamins, fluoride in multiple ways. I almost never convinced somebody that fluoride was what they should be using if they came from a position that was ideologically in a different camp about fluoride. Do you know what's the most convincing thing I was able to say to a parent about fluoride? I have 2 children. I love them both. They both got fluoride as part of their growing up. They happen to have been successful. It became an attorney and a dentist. I would never do anything to harm them. My grandchildren utilize fluoride, get fluoride treatment because we believe that it will give them a better oral health and a better quality of life. It's actually not arguing this on the scientific merit. It's talking to it as a parent or a grandparent. we have to start to think differently. At what lens is that person looking at us through? And our challenge as an academic is how to hand you that scientific paper and get you to read the quality of that paper and understand the paper as a scientist. But it's actually going backwards and getting you to understand how to communicate that with somebody that's not a scientist. So you will be men and women of science. You will learn to read the literature. You will learn to understand. You will be people that the community comes to with the confidence that you're going to do the right thing for them. And you're going to have to explain to people that are not nearly as educated or experienced as you, and I don't care whether they're PhDs in physics, they are not as educated in oral health as you are. And you're going to have to explain it in a language and in a methodology that they will A, believe you, and B, do the right thing for their child, if not for themselves. So it's very important that you realize the education you're going to get is going to be much bigger than about how to prepare a tooth or how to restore an implant. You'll get that too. That's the easy part, actually, of dental education. The hard part is getting you to actually be a trusted communicator to our community. So let's think about what we're hoping you will be in, let's see, where will we all be in 2077? Well, I don't know where I'll be. I have some good ideas, but what will you be able to point to and say you've accomplished? Who have you helped? How have we figured out how to change this segment of the world and make it a better place? Because if you're going to go through life counting how many Class II restorations, and I can't say that when I do the white coat ceremony to our real freshman class, but your particular class, for those that aren't dentists, it's a type of restoration between two teeth in the posterior of the mouth. If all your accomplishment is how many of these you accomplished, you haven't fulfilled what we're hoping for you. We're hoping that you will be leaders, that having put on the white coat today, you recognize that there's more about you than a procedure that's done on a patient or with a patient. That we are working together in an environment that can help build confidence in a society, improve the quality of life for children and adults, and at all times, never have done the wrong thing. Always thinking about your patient as the most important portion of the equation. Everything else, by the way, is going to work out for you. It's going to be stupendously successful. But we do have to think about that patient as the most important, that patient, not only that patient's family. We have to care about people. They have to have that sense. That's what you actually came here for. And what's important is that we don't let dental school beat that out of you. So I ask you to respect your patient. I ask you, when you put the white coat on, to recognize that your behavior is a 24/7 measure of what's happening here at Penn Dental Medicine. If you do great things, if you invent something wonderful, Penn Dental Medicine is going to be taking credit for you. Yep. We're going to take all that credit, and somebody from our development office will be reaching out to you and asking for a large donation after you do that, because I'm sure 50 years from today, some dean will be looking to do some giant project. Like I am, if any of you happen to have the resources. We want a nice 45,000 square foot research building to go ahead. Never mind, it's 100,000. It's a $100 million discussion, but no, your tuition isn't going up by $100 million. That 50-year reflection on who you are and what you've accomplished is really important. And if you've helped a few families do better in life and succeed, if you've helped be a role model for what dentistry is, that's absolutely incredible. You do something rotten, we're going to more than hate you, but you do put a blotch on Penn Dental Medicine. No matter what, after you're a graduate, while you're a student. We need to learn how to talk to each other. We need to have civil discussions while disagreeing vehemently on things. I don't have to be your best friend. I don't mind it, but I don't have to be your best friend. But I have to treat you with respect. I have to be able to communicate across. We have to be that vector that can actually help people learn to, you know, you're in the community, you're in a parent-teacher meeting and you know, association meeting. They still have PTAs and stuff? I know that was something. Yeah, they do. Okay. I was worried about that. And somebody is not speaking or saying in a fashion that we're happy with. We have to stand up as the leaders of our community and say, you know, can we say this in a better way? We don't have to say it with hate between people. We have to learn how to improve the society around us using the education, using the abilities, using the gifts that we have been given, and actually make a more successful world around us. That's a tall order for dentists. So, you know, in 2077, a couple of you will be deans, a couple of you will have been presidents of dental associations, will be parents, will be grandparents, will have families, will have done things successfully. But the greatest successes that you will have is what you can do for the society around you. So, in closing, the white coat is a pretty weighty item that says that you recognize your responsibilities. More important is just remembering who's wearing it, and that the white coat doesn't make you special, it gives you extra responsibilities. Thank you. Where are you going? Where am I?
So this is now, the time has come to formally introduce the class. What we will ask that each student in alphabetical order comes, introduce themselves, state your name and the country you are from. You will be then cloaked with white coat by our Vice Dean of Academics, Dr. Faizan Alawi. And after that, you will have the chance to take picture with our Dean Wolf, and those pictures you will be able to download later. So let's get started. Thank you.
Hello, Andrew, and I'm from Nigeria.
Hello everyone, myself Ved Biwalia and I'm from India.
Hello, I'm Arvind from India.
Okay, you'll get a piece of yourself into that, but we'll get you a slightly larger version, and let's get you straightened out a little bit there.
Hello, I'm Hirdepal Singh Brad and I'm from India.
Hello, I'm Jasprit Singh Chima from India.
Hello everyone, Namaste. I'm Khushbu Desai, I'm from India.
Hi everyone, I'm Laura Diaz, I'm from Cuba.
Hello everyone, I'm Hitika Duda and I'm from India.
Hello everyone, my name is Estrella Dominguez and I'm from the Dominican Republic.
That hair fluff is just very important. Hang on one moment. There we go. Do you want your hair out there? There you go. I'm kind of busy. Congratulations.
Hi, my name is Mina Fahmi and I'm from Egypt.
Hi, my name is Amal Baroudi Fasher from Sudan.
Hi, I'm Dhwani Gandhi from India.
Hi, I'm Yamini Guruswamy from India.
Hi, I'm Bexy Huerta Rodriguez from Cuba.
Hi, I'm Shweta Jain from India.
Hi, I'm Apurva Reddy Kanatala from India.
Hi, my name is Abigail Kovur and I'm from India.
Hello, my name is Estefania Lazo Pereira and I'm from Mexico.
Hi, I'm Anusha Luitel. I'm from Nepal.
Hello, everyone. My name is Alicia Madan, and I'm from India.
Thank you so much. Hi, Janil Malavia from India.
Hello, Amanpreet Singh Man from India.
Good evening. I'm Fatima Machaswala and I'm from India.
My name is Sandy Metri from Egypt.
My name is Bogdan Matichak. I'm from Ukraine.
Hi everyone, I'm Shrina Nellimat Sridharan from India.
Good evening, everyone. My name is Nidhi Bhimani Pediar. I'm from India too.
Good evening, everyone. I'm Manu Punganamamla, and I'm from India. Thank you, Dr.
Good evening. My name is Ghazal Parastui. I'm from Iran.
Hello, everyone. My name is Denis Barinov, and I'm from Russia.
Good evening, everyone. My name is Sonam Pathak, and I'm from Nepal.
Hello everyone, my name is Grecia Peramas Cardenas and I'm from Peru.
Hello everyone, my name is Ruslan Predkov, I'm from Ukraine.
Hello, everybody. I'm Saranya Devi Rajaram, and I'm from India.
Good evening, everyone. My name is Andrea Ruiz, and I am from Venezuela.
Hello everyone, my name is Michael Samaan and I'm from Syria.
Hello everyone, my name is Annapurneshwari Sridhar and I'm from India.
Hello everyone, my name is Maliha Sultana and I'm from India.
Okay, wave. There you go.
You're right.
Welcome again. I will now ask our Director of Multicultural Affairs and Inclusion, Dr. Beverly Crawford, to lead the professional pledge.
Hello everyone, good evening. Welcome to Penn Dental Medicine. The past class of 2027 will now recite the professional pledge found in your program. In the presence of you, their family, friends, and peers, they will publicly acknowledge the responsibilities of the profession and their willingness to assume the same. I ask the class of 2027, please rise and follow me in reciting the pledge. I would also like to invite any dentist in the audience who would like to renew your pledge as well. Please repeat each line as I have recited it. As I enter the dental medicine profession, I vow to keep this pledge and practice these stipulations. I understand that my primary responsibility is to my patients. To the best of my ability, I will embrace the highest standards of oral health care and treat all individuals under my care with respect and honesty, always placing the needs of my patients and community first above my own. I accept the responsibility to maintain my competence through the continued pursuit of new knowledge and skills in the practice of my profession. I will conduct myself with integrity, treat my colleagues with respect, and wherever possible, work to advance the oral health of society. I shall faithfully observe the principles of ethics and codes of professionalism encountered during my dental training and beyond. All this I pledge with pride in Penn Dental Medicine's heritage and my commitment to the profession and the public I serve. All this I pledge with pride in Penn Dental Medicine's heritage and my commitment to the profession and the public I serve. Congratulations. Please be seated.
Thank you all. Congratulations. This concludes the formal part of the ceremony. We invite you now to go up to the pavilion where pictures can be taken. So please let the students walk out first so we don't have a traffic jam. Thank you. We'll see you upstairs.